Alright, I call this the locked hip syndrome. It happens a lot in females more so than males. Definitely if you've had babies, it can happen more frequently. But I get comments and messages from thousands and thousands of women who have this problem. This hip, just trying to turn it outwards like that. So as you can imagine, having sex or intimacy is a problem, which is a big problem. Can't get the legs to turn outwards. It's a massive, massive trauma. This inability to turn it out. Even get it out past this point like this. It's really painful. And the pain can happen in here. It can happen here. It can happen in the front of the stomach. Unbelievable. Front of the stomach. So people start getting assessed for organ problems in this region, and it all shows up clear. Also, the side of your ribs through here, you can develop pain as well. Really interesting. It can radiate around the front, especially when you side bend. You would agree? So side bending is painful. Deep breathing, side bending can hurt as well. If you sit and maintain sort of sustained postures for a while, it really starts to get annoying. So like doing exercise is annoying because the pain can suddenly start developing again, and you can also develop pain in here. So through here, here, and here underneath, right here, frustrating, through your tailbone sort of region through here. The whole hip is locked. So I call it the locked hip syndrome. And a good way of testing it, of course, you can't cross your legs over and sit like this way. You can't put your legs up like this way because this hip will not externally rotate and it just feels jammed in here. I call it nerve locks that sit in here through your glutes, right here and here, which causes all this stuff. This stuff, nerve locks here, cause all this stuff. And you have a nerve lock sitting in your groin as well, and one at the front. Right. You'll know that something is wrong initially and you may have it, and nerve locks are the key because the hip just keeps getting tighter and tighter and more painful and dysfunctional when you're trying to do activities or even stretching. Classic one, when you try to stretch your groin muscles, your hamstrings, your glutes, like, oh, come on, just stretch out. It makes your pain feel worse. At best, it does nothing. You just keep feeling tighter and more dysfunctional and more pain later. But classic for nerve locks, you stretch, stretch, stretch. You try to trigger ball it, you massage it, especially aggressive massage, deep tissue massage, and wow, it makes your pain and dysfunction a lot worse. And you'll find if you do more of a gentler type stretching or osteopathic, gentle myofascial manual therapies, it feels better. When people talk about having had acupuncture or a very good dry needler for trigger points, it felt a little better. These are the signs that you have nerve locks. All in the pattern from basically L3 down to S2. And you can also, if you've had this long enough, and I meet a lot of women who've had this longer than 5 years. We have one here today in 6-7 years. I met last week, 12 years. That was incredible. You can start to develop nerve locks through this area as well of your muscles. The longissimus thoracis muscle group through here. Nerve locks there, and that causes the rib pains that can suddenly radiate up into your traps, mid to higher traps. So people start getting pain up here, it can refer this way. So people start getting problems up here. That's because it's been years that you've held on to this problem. Once it locks, it's done. How does it happen? So we have this case where they slipped in the shower, unexpected slip, something grabbed, and then it just gradually got worse. Some people that lift something heavy unexpectedly, they feel a ping here, they feel a ping here, something weird, it disappears, oh, it comes back again, and then it grows. It gets worse and worse and worse, and for some reason, it just starts to get heavier, tighter, more dysfunctional, more inhibited, and painful. And now, boom, it's locked, and it completely ruins your life progression because especially for active people, they can't get active the way they want to. They can't have sex the way they want to because the hip is literally locked. And you can imagine the emotional trauma and stress this puts on the body as well, which fuels the nerve locks again to keep going. So I hope that makes sense. Now, how to treat this? Oh, forgot to mention investigations. A lot of people get MRIs, CTs, X-rays, all blood tests, get the organs checked as well, ultrasounds of organs and so on, and everything shows up clear. Medically, you are healthy. It's interesting. Okay, moving on to how to treat it. My nerve lock treatment for the needles the Bostock Needle Technique, I'm going to unlock all the nerve locks. And once it's unlocked, it's a Control-Alt-Delete. Everything starts moving. And I've done a video on this previously where the lady suddenly, wow, the hip starts to come back. And it happens quite immediately. Once it unlocks, then it's about stretching and exercise that you've seen me do on previous videos for your glutes, your hips. It's gentle stretching every day with deep breathing. Do some breath work for your parasympathetic nervous system because of the stress, the emotional stress of this that's happened. Hoping your intimacy comes back really quickly, so that's good for the emotional side of your body and your organs and your pelvic organs here for females. So the unlock needs to happen, sadly. Wherever else you are in the world, try dry needling for trigger points or acupuncture. It's your next best options. In America, strain, counter strain, I always talk about a good form of manual therapy that helps release. Try Reiki as well to help release. But if it's failing, it is nerve locks. That's what I designed this treatment for. Nerve locks, the terminology I came up with over many years now studying this. So it's locking you down, but those options are helpful to the areas like your glutes and your hips to unlock this for you, and then the exercises must take place. If you have any questions, I'll talk to you again soon. I will do a video on exercise for the glutes and hips again in the near future, so look out for that. I'll talk to you all again soon.